Welcome back to the American College Surgeons Bulletin Brief from the Frontline Surgeons' Voices. With me today is Dr. Aaron Epstein, a fourth-year general surgery resident at the University of Buffalo in New York, who in 2015, as a first-year medical student, founded the Global Surgical and Medical Support Group. Welcome back, Dr. Epstein.
Thanks again. Appreciate being here.
Great to have you back. And we last spoke about the overall construct of the group and the history from 2015 to early 2022. And of course, later in 2022, things changed in the world, namely in the Ukraine, and your group had a very major role. So perhaps we could spend a few minutes chatting about the work done by the GSMSG in the Ukraine.
Absolutely. So my group makeup is a lot of security professionals with a lot of medical professionals and a lot of outreach into the global security world. I would say, ironically and unfortunately, several months ahead of this conflict breaking out in Ukraine, we actually had been in contact with the Ukrainian military saying things were starting to look really bad, and that we would like to offer as much training as possible to your population and military forces in combat casualty care in order to blunt the effects on your population in the event that there was an outbreak of war. And, for literally months, we kept making these offers. And I think people in the region were really in disbelief that this would actually happen. I think even now, people look at this as like the biggest strategic mistake that any nation has made in Europe since World War II. I think a lot of people are still in disbelief that this is even happening. So with the outbreak of the war, we had already set up and were in a good position to deploy our teams of medical professionals and primarily special operations veterans to Ukraine. And literally within days of the war actually breaking out, we were able to get our guys on the ground, which it did include U.S. surgeons. A retired Colonel Rob Lim, who's one of the surgeons in our group. I think he was the recent president of the ACS Excelsior Societies. Again, ACS representing where it matters. And yeah, so I think we're the only U.S. surgical team on the ground for the first several weeks of this conflict. Again, went back to our bread and butter of just training as many people as possible in combat casualty care. Part of what we did in that effort was we took the U.S. military's combat casualty care course, and within that they have different variations. They got one called the All Service Members course, which is meant for literally everyone in the military, and then they have the more advanced levels. And so with the aim of training the wider population, we took the All Service Members course, translated it all into native Ukrainian with native Ukrainian speakers, not the Google Translate nonsense, and basically started running these combat casualty care courses in person on the ground in Ukraine. And we're training anywhere from 100 to 200 people a day in how to do that basic care. I think just in terms of civilians to date, we have trained over 4,000 civilians. We've also trained at this point over 700 of their military members in how to treat battle injuries. Me personally, I'm not a board certified surgeon yet, but I am an ATLS instructor. So I did do an ATLS course and was training their physicians in how to do chest tubes, like wound closures, vessel ligation, stuff like that. Because at this point, you would hope everyone knows the whole stop the bleed, put a tourniquet on, right? But I mean, what do you do when you're the doctor that they're delivering the patient to with the tourniquet on and you haven't really dealt with that before? So vessel ligation was pretty key. And then even at the higher level, last week, I just got back myself from Ukraine a couple of days ago. And we held a high-level physician training course. And we had retired from the U.S. Army, Dr. John Holcomb, who basically is like the pioneer of U.S. military's trauma surgery. He's, one of their leaders in the most elite unit, which is called JSOC, or the Joint Special Operations Command Unit. We also had Dr. Stephen Wolf. He was the director of the U.S. Army's burn surgery program, and he's, one of the leading figures within burn surgery today, as well as Dr. Enrique Ginsberg down at Miami. So, he's the trauma director down at Ryder Trauma Center. We held a 2-day symposium that had, I think it was about 100 in-person Ukrainian physicians, as well as it was broadcast on Zoom to another 200 or 300 Ukrainian physicians because, they were out in the cities and, they were under attack and couldn't come to where we were. So it was easier just to broadcast it. So again, we went back to our roots of training and full spectrum. So whether it's the civilians, the military medics, the physicians, or the surgeons, we aim to just prepare them as much as we can by spreading that knowledge. And I think we've seen a good effect in that. Just to put some metrics beyond just the number directly trained, we made the translations of our combat casualty care courses online freely available for download. So anyone in Ukraine that had access to the internet could get it. And to date, we've seen at least 25,000 people download it. So beyond just the straight training and the direct person-to-person or even virtual contact, we're at least trying to get the knowledge out there to everyone and anyone that can get online. Hopefully it has an effect. Our teams are still there on the ground today. And I think we're, like I said, one of maybe two groups that have been there from the beginning, and we don't plan on quitting anytime soon. So we'll just keep going.
Well, indeed, you are an organization that is very important. I'm no doubt that you will keep going, and I'm very impressed by the work you're doing. It's truly incredible, especially at your stage of your career. As you say, not yet board certified. You're making all of us surgeons proud for the giving back that you're doing. And again, it's easy to understand why, as a second-year resident in 2020, you were bestowed with one of the Pfizer Humanitarian Awards from Operation Giving Back. You certainly are giving back, and then some. So thanks again for all you do for humanity, and thanks for your time with us today.
I appreciate it. I think with all the medical professionals, I think we just try and do what we can to give back a bit. So just something to do.